This is a list of symptoms from the National Fibromyalgia Association, and I will go through it. Chronic widespread body pain is the primary symptom of fibromyalgia, and I think it was in 2010 or 11, something like that. I'm going on memory. They changed it to this instead of having X number of tender points. Okay, I'll continue. Most people with fibromyalgia also experience moderate to extreme fatigue, sleep disturbances, sensitivity to touch, light, and sound, and cognitive difficulties. Many individuals also experience a number of other symptoms and overlapping conditions, such as irritable bowel syndrome, lupus, and arthritis. Let me start at the end here. Lupus and arthritis are rheumatological conditions, and and quite often fibromyalgia patients get sent to a rheumatologist, and those are diagnostic, diagnosable conditions instead of a grouping of symptoms. Um, what I would like to do next is to compare these symptoms to Cushing syndrome and also hypopituitarism, as in particularly growth hormone insufficiency. Um, in a different video, I will also um, get into different studies I actually found that um, show that people with fibromyalgia are low in human growth hormone. But for the moment, we'll go over the symptoms. I found an interesting article under the website fibromyalgiatechie.org, and um, a brief excerpt from it is Cushing syndrome and fibromyalgia. Fibromyalgia and Cushing syndrome share a number of overlapping symptoms, including fatigue, muscle weakness, depression and anxiety, emotional swings, cognitive difficulties, and headache. In addition, disrupted menstrual cycles are a common symptom associated with both conditions. These commonalities can make differentiating between the two conditions difficult during the diagnostic process, particularly in cases where there is no obvious glandular tumor to blame. Additionally, many individuals with fibromyalgia-like symptoms suffer from chronic pain and arthritic type conditions. Well, I want to back up just a little bit here for a minute um, to where it says, particularly in cases where there is no obvious glandular tumor to blame. Well, you got to go looking for it. This is when the hormones need to be tested, at least initially, with a good endocrinologist, and then go from there. Additionally, many individuals with fibromyalgia-like symptoms suffer from chronic pain and arthritic-like conditions. Well, one of the functions of cortisol is to help regulate your inflammatory response. And so typically, at least in me and others, you do get arthritis-like conditions. On that note, I found a interesting write-up, and it's titled Fibromyalgia in a Patient with Cushing's Disease Accompanied by Central Hypothyroidism. And this is about a 39-year-old woman with a 3-year history of a rounded face and widespread myalgia. The rounded face is a symptom of Cushing's, and myalgia, of course, is pain. Detailed examination revealed no disorders that could explain the pain. along with the Cushing's and hypothyroidism. Both the high cortisol and low thyroid completely resolved after the patient underwent surgery to treat the Cushing's, but she continued to have unresolved pain that met the criteria for fibromyalgia. Um, Few studies have so far investigated patients with fibromyalgia associated with Cushing's. Well, maybe there needs to be more. Okay, in our case, the low thyroid caused by Cushing's probably played an important role in triggering and making worse the fibromyalgia. This highlights the need to examine the endocrine function in patients with muscle pain. Well, bravo to that last statement. Um, and also, it would be nice if they would look at Cushing's, especially if there's any kind of weight gain. Um, but I was pretty disappointed in what they stated here. In our case, hypothyroidism caused by Cushing's probably played an important role in triggering and making worse the fibromyalgia. Well, yes, hypothyroidism can cause muscle and joint problems, but you know what? So can Cushing's. One important thing they did bring out is that the Cushing's could trigger a thyroid issue. Bravo to that, because they work as a team. One hormone system can affect another. But back to the Cushing's, as I stated, uh, cortisol can play an important role in your inflammatory response. And I just want to give a common sense example of say you go to the doctor for a trashed knee and they give you a steroid injection, and this brings the inflammation down. And a steroid injection is on par with cortisol. And cortisol is made by your body. So let's pretend you have, bad osteoarthritis in your knee. Well, they're going to limit the frequency of the injections because too often can actually cause damage. And this is just the facts of life. So imagine if your cortisol is high or fluctuating and it's all over the map. Well, this could really mess with your muscles and joints on its own accord. So to blame it all on the thyroid is naive, I guess, would be a good way of putting it. Okay, thank you. Here we have the symptoms of growth hormone deficiency in adults. And it's another compare and contrast, with fibromyalgia. This video is not like all encompassing because, there are, hypothyroidism can cause some of the similar symptoms. And again, rheumatology disorders. But okay, let's look at the symptoms of growth hormone deficiency. Anxiety and or depression, baldness in men, decrease in sexual function and interest, decreased muscle mass and strength, difficulty in concentration and lack of memory, dry, thin skin, elevated triglycerides, fatigue and or tiredness. Just a thought on that. I would call it exhaustion. Fatigue is not a big enough word. Okay, heart problems, cholesterol problems, insulin resistance, lower tolerance to exercise, reduced bone density, making you more susceptible to osteoporosis, sensitivity to heat and cold, very low energy, weight gain, especially around the waist. Um, and yes, some of these symptoms could be thyroid. Some of these symptoms can be Cushing's. And this particular slide really outlines the importance of, getting your cholesterol checked, getting your vitamin D checked, in regard to your bone density. D plays